Breastfeeding protects children against ear infections, upper respiratory tract infections, gastrointestinal problems like diarrhea, and very importantly, breastfeeding has been consistently associated with a 30% lower risk of development of childhood obesity later on. Breastfed children have higher IQs when they are in middle school and even high school. Breastfeeding has been associated with protection against breast and ovarian cancer, and we also know that breastfeeding is very important for the prevention of postpartum hemorrhaging in women. So the U.S. has significantly worse breastfeeding outcomes than obviously most developing countries in the world, if not all developing countries in the world, and many industrialized nations, for example, the Scandinavian countries and so on. And breastfeeding duration is exceedingly short in the US compared to many other countries. And that is where we have to invest a lot of resources and thought as to how to make breastfeeding the social norm and how to make the environments much more friendlier to women.
Goals are public health goals set by the U.S. Department of Health and Human Services. The number of women who actually start breastfeeding is currently at 75%, and we'd like to see that at 82% by the year 2020. We also would like to see, the recommendation is that women breastfeed their infants for the first year of life. Currently, we have 23% of women breastfeeding at 12 months. We'd like to see that up to 34%. We'd like to decrease the rates of formula supplementation of breastfed infants during the first 2 days of life. We see a lot.
So only 60% of black women breastfeed their babies compared to 80% of white women who select or make the choice to do so. At 6 months after birth, these ethnic racial disparities persist, and only 25% of black women are breastfeeding at 6 months versus 45%. Infant formula supplementation among breastfed babies is much more common among black and Hispanic women versus white women, and this disparity can be detected as early as 2 days after birth.
Looked at differences between Latinas who are from Puerto Rico versus Latinas who are from other Hispanic countries, and we found some very significant differences. For example, in one group of women who were all considering breastfeeding, we found that 99% of the women who were non-Puerto Rican Latinas, and they were primarily from Mexico, Peru, and Colombia, 99% initiated breastfeeding. However, only 80% of the Puerto Rican moms did initiate breastfeeding.
For example, in California shows that the same happens with immigrant women from Southeast Asia, where they may have breastfed the last child born in Southeast Asia for over a year, but the youngest child born in the US receives the free infant formula through WIC, and they totally give up the breastfeeding. Elsewhere, what the global experience tells us is that we need to address issues at the hospital or maternity ward level. We also need to be able to promote and support breastfeeding at the community level, and we need to protect the breastfeeding behavior against unethical practices of marketing by infant formula companies, and also to protect breastfeeding by improving maternity leave legislation. And
breastfed babies have a lower incidence of all sorts of health outcomes, from ear infections to gastroenteritis and diarrhea, to SIDS, to necrotizing enterocolitis, which is a very serious complication for children. Really affordable health care begins with breastfeeding.